in science, you deal with data and you deal with evidence. Now, let's look in Africa, for instance. Where did we see MERS? Where have we seen coronavirus outbreaks before? We saw them in the Middle East. We saw them in Egypt. Those are, as far as I know, they are very hot places. I've not been to Egypt before, but what I can tell from everything I've seen on TV, it's not necessarily a temperate location. Now, even if we think about the coronavirus, especially at the beginning of the outbreak, some of the highest case fatality rates and even viral transmission rates were in North Africa. So we saw, I think, Algeria, Tunisia has done really well to bring their things down, but now they seem to be rebounding cases again. So North Africa, places that are sometimes even hotter than in Ghana, had high spread. Now, in Ghana alone, you can see now we had 40,000. It hasn't been an exceptionally cold time in Ghana. It has been as seasonably hot as it usually is. And then you can look at the US and in Europe, they are going through summer. The US has not really shown a decline. If anything, Texas, others, California have shown higher rates of COVID during these times. So I read a report once that the link between, seasonal outbreaks has less, sometimes there can be a component of cold weather affecting transmission, but it's also human habits. In temperate areas, when it's winter, people are indoors. They are breathing in recycled air, and it's basically recycled air, heating, all of that creates an environment that promotes the spread of respiratory viruses. So it's not so much that it is cold, and so the virus is happy in the cold. It's just that because it's cold, people are indoors and are around each other, and so it spreads. Now, in Ghana, we are in a hot country, but where do we spend most of our time? Indoors in air condition, which is basically like the flip side of being in a cold place and being indoors in a heated house. So it's really about transmission from person to person. What are the activities? So I think that is why very early on there were lockdowns, there were bans on social gatherings. Some of these bans still are maintained. As Dr. Tichi said, it's not just wearing a mask, it is social distancing. If somebody has the virus, but I'm more than 2 meters away from them and I'm wearing a mask, my risk of catching from them drops to very, very low. If on the other hand, I'm standing very close to them or I'm sitting next to them in a trotro, as we discussed last week on this show, and they are talking or they are not wearing a mask, potentially I am much more at risk. So I think, all the evidence suggests that if Africa has indeed fared better than other regions, which based on our mortality rates appears to be the case for now. And once again, as Dr. Tichi said, we are not out of the woods. The moment we relax is when the thing explodes in our face. But for now, at least in Ghana, our case fatality rate of 0.5 is lower than in other places. We can be thankful for that. I suspect it is less to do about the weather and more about perhaps our population structure. We have a younger population. The median age in Africa is 19 years old versus about 38, over almost 40 in other parts of the world. That means our population structure means we have fewer old people. In Ghana, life expectancy is 63. In other countries, it's over 80. So the most vulnerable people, the people who have carried the burden of death, have largely been elderly and then people with comorbidities. The challenge we have, though, is we have a high number of people with undiagnosed comorbidities. So just because you are young doesn't mean you are safe. We always sound that caution. Also, we are a little bit more isolated from the rest of the world. If you compare the US, how they are linked with China and Europe, you cannot compare that to the number of flights that come in Accra or come onto the continent of Africa. Africa is still slightly more isolated than the rest. And so the virus took a bit longer to get here. But I think, just to go back to your original question, I think it's all the evidence would suggest that just the fact that it's sunny outside or it's hot has very little to do with blunting this virus. Because once again, think about where the virus spends most of its time. It's not on a seat or on a bench, it's inside your body. And all our body temperatures are kept, no matter where you are, as long as you're alive, your body temperature is the same. So the virus is happy in your lungs, just waiting for you to cough. And once you cough in an air-conditioned room, in an office, in a bank, in a trotro, in a school classroom, wherever it is, the transmission will happen. It's not so much that the virus is floating around in the middle of sunny Accra trying to find some.